My name is Sean McFadden. I'm an obstetrician and gynecologist from Omaha, Nebraska. And I have suffered with TMJ for about 4 years, and I've seen Dr. Nassery, who's helped me out tremendously. My story begins in Chicago, Illinois, where I was born and raised for 35 years, and was the recipient of a lot of old school dental care that resulted in a lot of deep fillings and a lot of veneers. After I had moved to Omaha, Nebraska, approximately 15 years ago, I had a dentist that wanted to remove the veneers to check for decay behind them, and then recommended that crown work be done. Having a relationship with him for the last approximately 10 years, took his recommendations, at which time things rapidly spiraled downhill. It was a result of some malocclusion that wasn't being rectified. Ended up transferring care to another physician who rectified the problem by redoing some crown work, but then became very aggressive with my care and proceeded to perform some more crown work. And over the course of about 6 months, ended up in the worst pain of my life. Substantial. It got to the point to where I was on disability, short-term disability, where I could no longer perform surgeries. I could no longer perform any delivery whatsoever, and my partner, who's my wife, basically had to take over doing all major surgeries and deliveries. I continued to do as much as I possibly could at work, but I used to work from 7 in the morning till 6 at night, 5 days a week, and I'd work every Saturday. And I got to the point to where I could only work till about 12 o'clock in the afternoon. I had seen multiple general dentists in the city of Omaha that were trained at Creighton University Medical Center and Dental Center who did the best they could, but they were functioning within the scope of their practice and the fund of their knowledge. And all of them thought that they could get me out of pain by putting me in anterior splints. And I was progressively becoming worse. I got to the point to where I was having pain 24/7. I was having right facial droop. My right arm and hand were swollen, and I was almost exhibiting stroke-like symptoms. And their diagnosis rapidly became, "We don't know what's wrong with you. You must be the problem. You're a surgeon, you're high stress, you're anxious, and since we don't know what's going on with you, you obviously must be the problem." But I never gave up. And I kept searching and I kept searching, and I went through 2 neurologists, 1 neurosurgeon, 2 chiropractors, several physical therapists, about 6 dentists, until a particular dentist said, "I think that we are making the situation worse with the splints. And I think that you need the opposite treatment. But I want a referral, and I want to get the opinion of a gentleman named Mark Piper, who is in St. Petersburg, Florida." Mark Piper is a medical doctor who is a board certified oral maxillary surgeon and also went to dental school. Mark Piper evaluated me and agreed with that dentist that the general dentists were making my situation worse because the splint that they were putting me in was driving my mandible posterior and superior and impinging the temporomandibular joint and creating chronic regional pain syndrome. And I needed the exact opposite treatment, which was I needed to have my vertical dimension opened and I needed my mandible dropped down and forward. And the situation there was I needed basically a neuromuscular dentist that was trained in the neuromuscular school that would be capable of redoing all the dental work, redoing all the crowns, in essentially opening the vertical and then dropping the jaw forward. Regarding Dr. Nassery's care, I think it's important to highlight that what he brings to the table is not only his infrastructure, but his scope of knowledge of not only obviously the jaw, but also the neck and posture, and what's also required regarding physical therapy. Because the other dentist that I was dealing with is very interesting. It's a dentist in their office, and there was nothing set up as far as an infrastructure. When I was going through this process, it was fascinating, because being a physician, I'm not a dentist, but I was able to connect some dots. And I would ask the dentist, do you know any good ear, nose, and throat that you work with? And they would say, no. Why don't you go see who you trust? I would ask them about neurology, neurosurgeons, physical therapists. This had never even crossed the average dentist's mind. And there's an old phrase, the English translation is, the mind does not see, or the eyes do not see what the mind does not know. And I was in their office, and if they would have taken the time to look at me and fully examine me and listen to me, I was screaming TMJ. I was screaming myofascial. I was screaming referred pain. But they, A, didn't have the education, but B, were not looking at the big picture. It was very interesting walking into an office where a dentist was very cognizant of, obviously, not only was this a jaw issue, not only was this a joint issue, but this was a myofascial issue, a neurological issue, and a posture issue, and a cervical spine issue. So that is a testament not only to Dr. Nassery, but just the field of neuromuscular dentistry, hence the term neuromuscular, where they're not just looking at the teeth and they're just not looking at the jaw, but they're looking at the big picture, which is quintessential if we're going to move forward in this field of TMJ or TMD, and how do you bring about resolution. I have gone from being disabled, excruciating pain, not being able to work, to a point in my life where I can do what is required of me as a physician, as a surgeon, and as a husband, and as a father. There was a window of time where, not to tout my Catholicism, but I would go to bed at night holding a crucifix. And the only thing that kept me from killing myself was my wife and my children. I was in so much pain. It was unbelievable. The other issue was hopelessness, no diagnosis. I had general dentists telling me that I was crazy. I had general dentists telling me that they didn't know what was wrong with me, and actually I was the problem, because I kept on going from dentist to dentist. I was a doctor shopper, and because I was a surgeon, I was high strung. And because I was a surgeon and a pelvic reconstructive surgeon, and I was in a very high stress job, that I obviously grinded my teeth, and this was, quote, all my fault. So it's interesting when you sit back and you look at, because of the love of your wife, because of the love of your children, because of the love of your family, but also because of docs like Nassery, you get from point A to point B, where there's a window in your life where you're essentially almost robbed of everything, and now you're back on your feet. So it's been a long journey, and he's a godsend and a lifesaver. So for those of you who are looking for a doc to take care of you, it's important. It's important that you pick the right doc for you. But this is what I can tell you. That I was 45 years of age, and I had a very busy practice, a beautiful wife, 3 kids, and my life was pretty good. And because of some very aggressive and inappropriate dental work, I rapidly became disabled and was in a tremendous amount of pain, physically, mentally, and spiritually. Did not have a diagnosis, and actually was being blamed for my diagnosis. With the support of my family, my friends, and my persistence, ended up on Dr. Nassery's doorstep here in Miami. It's funny how life works out. But because of Dr. Nassery's commitment to his craft and his art, and because of his relationship with the physical therapist, and because of his extensive network with people that he does communicate with, specifically his mentors and the lab technicians, he's been able to get me to the point to where I'm back on my feet. And for that, I owe my life. So if you're thinking about Dr. Nassery, you're not going to go wrong.